In this lecture, we are going to talk about clinical abnormalities of body fluid volume regulation, and its most important causes hyponatremia and hypernatremia. Basically, clinical abnormalities in the body fluid volume can arise in disturbance of any electrolyte, but the most important electrolyte in the body is sodium, and it's anion the chloride, which basically contributes to the more than 90% of the plasma electrolytes. So every electrolyte, every ion is important, but sodium is contributing around 90% along with its anion chloride. So it's important to discuss sodium because any disturbance in the plasma sodium concentration, any increase or decrease in the plasma sodium concentration can lead to a lot of clinical abnormalities in the body fluid volume. Similarly, any change in the body fluid volume can disturb the level of sodium in the plasma. Now, the normal level of plasma sodium is around 142 milliequivalent. Any increase in sodium volume, in the amount of sodium in the plasma sodium above 142 is basically hypernatremia or increase in plasma sodium. Any decrease below 142 in the plasma sodium is hyponatremia. So hyponatremia is basically hypo or decrease in the sodium, and a hypernatremia is basically hyper, an increase in the sodium in the plasma, in the blood plasma. And they are the increase and decrease in the sodium levels are the most common clinical abnormalities related with the body fluid, and they basically give rise to a lot of clinical abnormalities. Now, we will discuss some of the most important causes of hyponatremia, and then we will discuss some of the important causes of hypernatremia. Now, the decrease in sodium, can either be due to the actual decrease in sodium or it could be due to the fluid loss. So depending upon the cause, the decrease in sodium could be hypo-osmotic dehydration. It could be due to hypo-osmotic dehydration, in which there is basically fluid loss, along with basically sodium loss. So there could be sodium plus fluid loss, or the sodium remains the same, but the amount of fluid increases. So the actual amount of sodium concentration basically decreases. The amount of sodium remains the same, but the fluid increases, the water increases. So the concentration of sodium basically falls, which is basically hypo-osmotic overhydration. Now, the conditions which are responsible for hypo-osmotic dehydration, in which there is sodium loss plus fluid loss. There is a decrease in the sodium, there is decrease in the plasma sodium concentration, and there is also decrease in the fluid volume. There is decrease in sodium and there is decrease in fluid volume. This condition is basically hypo-osmotic. This is basically hypo-osmotic dehydration. And the causes are basically diarrhea, vomiting, adrenal insufficiency, and diuretic overuse. In diarrhea and vomiting, there is direct loss of sodium, there is direct loss of body fluids. So the sodium amount decreases, the volume of a body fluid decreases. But the thing is that intracellular fluid remains the same, or it may even increase. But overall, there is a decrease in the fluid and there is a decrease in the sodium, because both the sodium is lost and the fluid is lost. Water is lost. So basically there is dehydration, and this type of dehydration is hypo-osmotic because sodium is lost, so osmoles are lost. Every sodium particle is basically giving some osmolar pressure. When these osmolar particles are lost, so osmolarity decreases, and that's why they are called hypo-osmotic dehydration. Because dehydration is occurring, fluid is being lost along with osmoles. So this condition is basically hypo-osmotic dehydration, and the causes are diarrhea, vomiting, in which there is direct loss of fluid and sodium. Then there is adrenal insufficiency. In adrenal insufficiency, there is decrease in the formation of aldosterone. Sodium cannot be absorbed from the kidneys, so there is loss of sodium, there is decrease in sodium, and there is loss of fluid. So there is hypotension. Similarly, in diuretics overuse, basically they are used for treatment of edema or heart failure, but if they are used in their overuse or their poisoning, there is decreased absorption. There is decreased absorption of sodium in the kidneys, so a lot of sodium is lost in the urine, and a lot of fluid is also lost in the urine. So there is decreased fluid and there is decreased sodium. All of these conditions, diarrhea, vomiting, adrenal insufficiency leading to decreased aldosterone formation, and diuretics overuse, they all lead to direct loss of sodium and direct loss of osmoles. So they all causes hypo-osmotic, and there is direct loss of fluid. Fluid is lost, so they causes dehydration. So all of them are causing hypo-osmotic dehydration. Then there is another cause of hyponatremia, in which basically the amount of sodium decreases. Basically the concentration of sodium decreases. The actual amount of sodium which normally is present, it remains the same, but there is so much increase in fluid. That the concentration ultimately falls. There is so much increase in fluid that the concentration actually loss. Now, suppose for example, if one sodium particle is present for like 1 ml. Now with the increase in fluid, for example, it becomes 2 ml. Now when the sodium initially was present 1 particle for 1 ml and now it is 1 particle for 2 ml, the osmolarity, the osmotic pressure, the amount of pressure it is applying, it basically falls. So it is also in a hypo-osmotic condition, but the thing is there is increase in fluid, there is no dehydration, there is rather increase in the fluid volume in the body. So this is a hypo-osmotic condition with overhydration. So this is a condition in which hypo-osmotic condition occur with overhydration or increase in the fluid volume. Now the causes of the hypo-osmotic overhydration includes those conditions in which there is excessive antidiuretic hormone secretion like bronchogenic tumors. In these tumors there is excessive secretion of antidiuretic hormone or syndrome of inappropriate ADH secretions. In these conditions, there is a lot of antidiuretic hormone secretions. It may be a tumor or it may occur in bronchogenic carcinoma. They basically lead to a lot of water absorption in the kidneys. In adrenal insufficiency, there is decrease in aldosterone, so there is fluid loss in the urine. In excessive ADH, there is a lot of water absorption in the kidneys. There is no absorption of sodium. There is no absorption of sodium, but there is a lot of absorption of water. So the amount of water increases, which leads to overhydration. So excessive ADH basically leads to a condition in which hypo-osmotic overhydration occurs and which is basically a cause of hyponatremia, in which the sodium concentration decreases, but the decrease in the concentration is due to the overall increase in fluid volume. There is overall increased retention or increased absorption of fluid by the kidneys due to excessive ADH or antidiuretic hormone secretion. The purpose of the ADH is to absorb a lot of water from the kidneys and retain the fluid, retain the water in the body. In case of adrenal insufficiency, the aldosterone is not even absorbing sodium and it is not absorbing fluid as well. So both the sodium falls and the fluid level falls. But in this case, in case of ADH, it only absorbs the fluid. So the amount of sodium remains the same, but fluid volume doubles in amount. Overhydration occurs, so ultimately the concentration falls and hypo-osmotic condition develops. And both are hypo-osmotic dehydration and hypo-osmotic overhydration can cause hyponatremia. Now there are some conditions which basically leads to increase in the concentration of sodium, which causes hypernatremia. Those conditions can also be either due to dehydration or with overhydration. Now, the conditions in which there is hyper-osmotic dehydration, there is loss of fluid from the body, but no loss of sodium. There is no loss of sodium. So when there is decreased amount of fluid, for example, initially one sodium particle was present for 1 ml. Now 0.5 ml is present, 0.5 ml. One particle for 0.5 ml leads to increase in the concentration of sodium. The amount of sodium is the same, but the fluid is lost. As in ADH, antidiuretic hormone secretion, the amount of sodium was the same, but excessive volume or water was retained, which led to hypo-osmotic overhydration. Here the amount of sodium is the same, but the fluid is being lost. So that the concentration ultimately increases because one particle is present for less amount of fluid. Now those conditions in which such hyper-osmotic, in which the number of osmoles increases, those conditions include diabetes insipidus. In this condition, there is a lot of fluid loss. The antidiuretic hormone is not basically performing its action on the kidneys and it is unable to absorb water. So that water is basically lost. In excessive ADH secretion or in syndrome of inappropriate ADH secretion, there is a lot of fluid retention, a lot of absorption of fluid, or the fluid in the body doubles. So overhydration occurs and the sodium concentration falls and a hypo-osmotic condition develops. Here in diabetes insipidus and in excessive sweating, there is more fluid loss and less sodium loss. So sodium concentration ultimately increases, which leads to a hyper-osmotic condition. But along with that, there is fall in the fluid. And due to fall in fluid in the body, extracellular fluid and intracellular fluid, this fluid falls. So basically it is a dehydration. Due to decrease in fluid, there is dehydration, but due to overall increase in the sodium, there is hyper-osmotic condition. Now, osmolarity is basically dependent upon the number of osmotically active particles. Every sodium particle is osmotically active. If the amount of sodium decreases, a hypo-osmotic condition will develop because every losing sodium particle is basically producing a decrease in the osmolarity, and every losing sodium particle leads to a hypo-osmotic condition. Now, if that condition is associated with fall in fluid, it will be a dehydration, and if it is associated with increase in the fluid amount or absorption of a lot of fluid, then that will be associated with overhydration. So these conditions were associated with hypo-osmotic dehydration, hypo-osmotic overhydration. Now here, the osmolarity has increased and the fluid has decreased. So it is a hyper-osmotic, in which the sodium concentration has increased along with the dehydration, in which the fluid has decreased, or a lot of fluid has been lost in sweating or in diabetes insipidus due to inability of ADH to perform its function and its function of absorbing the water from the kidneys. Finally, there are some conditions in which there is fluid absorption along with sodium absorption. Fluid absorption along with sodium absorption. In excessive ADH, only fluid is absorbed. But in Cushing's disease, and in primary aldosteronism, in these conditions, there is absorption of sodium and there is absorption of fluid. So both the extracellular fluid and both the sodium concentration increases, and there is a hyper-osmotic condition because the sodium concentration is increasing, because the number of osmoles are increasing, because the osmolarity is increasing. So it is a hyper-osmotic condition, and along with that there is increase in the fluid, there is increased absorption of the fluid from the kidneys. So there is overhydration. So these conditions, the Cushing's disease and primary aldosteronism, they lead to increased sodium absorption and increased fluid absorption. Both of them will lead to hyper-osmotic overhydration. In adrenal insufficiency, there was less amount of aldosterone formation, due to which there was decreased sodium absorption and decreased fluid absorption. So fluid decreased, along with that sodium concentration decreased, which led to a hypo-osmotic dehydration. But in primary aldosteronism, there is excessive sodium absorption, along with that there is excessive fluid absorption. So both the extracellular fluid volume increases, along with that there is sodium concentration increase, because sodium is also absorbed from the kidneys. So it leads to a hyper-osmotic overhydration. Now, finally, we are discussing these conditions because all of them are affecting the plasma sodium concentration, and sodium is one of the most important electrolyte or ion which contributes to the osmolarity of the plasma. Now, any condition which decreases the plasma sodium is hyponatremia. Any condition which increases the amount above 142 milli equivalent is basically hypernatremia. Now, both hyponatremia and hypernatremia, it could be associated with dehydration or overhydration. Now, if they are associated with dehydration along with loss of sodium, along with loss of osmoles, along with loss of electrolytes, then they are labeled as hypo-osmotic dehydration. But if there is no loss of fluid, but there is only decrease in the sodium concentration, then we label it as hypo-osmotic overhydration. Similarly, if there is increase in sodium, but there is loss of fluid, then we call it as hyper-osmotic dehydration, because the number of osmoles are increasing, osmolarity is increasing, but fluid is being lost, dehydration is occurring. So these conditions are called hyper-osmotic dehydration. And a good example is diabetes insipidus, in which ADH cannot function, so fluid is lost from the kidneys and sodium is retained. So the amount of sodium increases, concentration increases, and the fluid is being lost. Now, another condition in which the sodium and fluid both are absorbed, like Cushing disease and primary aldosteronism, those conditions which will increase the osmolarity and they will increase the hyper-osmotic condition. Along with that, they will absorb a lot of fluid and they will cause overhydration. So they cause is hyper-osmotic overhydration. So that's all about the important clinical abnormalities of the body fluid, which are basically most commonly hyponatremia and hypernatremia. Although abnormalities of the potassium and chloride are also common, and hyperkalemia, hypokalemia can cause life-threatening conditions, but sodium and chloride are contributing 90% of the osmolarity. So initially, it is important to discuss the factors, all those factors which could increase or decrease the amount of sodium or in the plasma or along with the body fluid. So thanks a lot for watching the video.